if clinic leaders start a process by which they gather input directly from the employees and listen and take note of the potential solutions that the employees can bring, this can go a long way in order to reduce burnout, which is one of the most pressing issues in this post-pandemic world. My name is David Hurtado. I am an assistant professor at the Oregon Institute of Occupational Health Sciences at Oregon Health and Science University, and I also have a teaching appointment at the OHSU PSU School of Public Health.
I'm Dr. Abigail Lenhart. I'm an associate professor of medicine at Oregon Health and Science University, and I'm a member of the OHSU Wellbeing Leadership Team.
The title of the article is Promise and Perils of Leader-Employee Check-ins in Reducing Emotional Exhaustion in Primary Care Clinics, Quasi-Experimental and Qualitative Evidence. This will appear in the June issue of Mayo Clinic Proceedings. The takeaway message of this article is that clinic leaders can try to reduce emotional exhaustion and possibly burnout by holding frequent and private meetings with their staff members, with their team members. And the rationale for these meetings is that holding meetings one-on-one with team members can do two things. One, improve the relationship between leaders and team members. And second, identify and hopefully modify the work stressors that ultimately lead to emotional exhaustion and burnout. Our study has two parts. In the first one, we examined a survey that we conducted among 10 primary care clinics where we identified that a primary care clinic where leaders were holding frequent and private check-ins with the staff members were doing better in reducing emotional exhaustion and aligning values with their team members at least one year after these check-ins were conducted. And the second part was trying to replicate that check-ins process in a new clinic. And we did it to test the feasibility of this replication amid a very turbulent time, which was about the time when the Delta variant was hitting healthcare systems. The check-ins are a 30-minute one-on-one encounter with the purpose of gathering information, make a work plan or an action plan with the team member and following up. The check-ins are swift and easy to implement strategy to address burnout at primary care clinics. The goal is to listen and to try to address the stressors that clinic leaders have, within their ability and power, so that they can either validate the stress from the perspective of the employees and, more importantly, try to reduce the drivers of burnout. So in our first study, we not only analyzed surveys where we show that the clinic where check-ins were conducted did better in terms of emotional exhaustion reduction, but also we interview the key players. By that, I mean clinic leaders and employees of that clinic to learn what happened during those check-ins, what were the mechanisms that explain why emotional exhaustion was reduced, and how we can move forward with that practice in new clinics. We learned in those conversations that the reason why the check-ins were useful to reduce emotional exhaustion is because leaders pay attention and listen to concerns of their employees, they validate them, and also they try to address the stressors that within their level of power and authority were modifiable. And those two reasons largely explain why employees at the clinic where check-ins were conducted did better in terms of emotional exhaustion. Now, the feasibility replication study concluded that the check-ins have a very adjustable and relatively low admin burden. The concept is straightforward. The application and implementation is not burdensome, but two caveats need to be provided. The first one is that leaders need to set boundaries once they start listening to work-life situations that may be affecting the performance or the stress levels of their team members. As clinic leaders, their role is to ask how the clinic should support them as opposed to try to make judgments or comments on their personal work-life situations. And secondly, we also need to pay attention to the stress levels of supervisors themselves, and clinic leaders themselves, as they start listening to employee concerns. Their levels of frustration or even stress can also increase. So this has to be also one element to be recognized once we move forward with this study.
So how does these findings relate to clinical practice? We know that burnt out clinicians, burnt out teams, burnt out organizations do not provide as safe patient care. We also see that patients are less likely to adhere to treatment plans or medications when they're working with burnt out team members. We also know that burnt out clinicians are more likely to leave practice, more likely to reduce their work hours, and we see high levels of turnover. So this is a really critical intervention in terms of ensuring that we have a healthy workforce that can provide exceptional care to our patients. And that is sort of the main implication for our patients with this research. What is also unique and novel about this is that we know that burnt out and the drivers, while they are generally universal, there's unique implications in each practice and for each individual. And this model is really promising in that it has a standard way of trying to approach the issue of burnout, but it is modifiable and unique to the person in front of you and to the clinic environment. And so we think that this is a great next step in trying to preserve our workforce that has gone through a myriad of stresses in the last few years and even in the decades before. Next steps in this line of research is to do a randomized controlled trial to really see if this intervention is truly beneficial in protecting our team members, improving emotional exhaustion, so we can see if these results that we found that are so promising are truly generalizable to our other healthcare units, teams, and clinics across the nation.
This study is the basis for a randomized control trial that we're currently doing as part of the Oregon Healthy Workforce Center, a NIOSH-funded Center for Total Worker Health Excellence. And we believe that this study has important and practical implications for primary care clinics that are trying to do something to reduce burnout.
We invite you to learn more and read the article in the Mayo Clinic Proceedings in the June 2023 issue.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.